A lot of people will actually have back pain for no real reason as far as an injury or serious condition. Most people just get back pain because of improper techniques when they're trying to lift, the prolonged sitting, the poor posture with carrying stuff, things like that, with the imbalance of muscles. So more and more people are complaining of back pain, and actually even younger people are complaining of back pain. A lot of people have the mentality that I'll just wait and see what happens because they feel like it's going to go away pretty soon, and most of the time, within about 6 weeks, traditional back pain will get better. However, if you notice things that are not getting better within 3 to 4 weeks about that, then you should definitely get it looked at right away. So I'm going to go over some conditions with you that we commonly see in physical therapy. As we get older, things obviously do not want to stay in place. Other conditions involve just wear and tear over time, as well as involving abnormal lifting mechanics, which will produce issues in the back. And then the other thing is posture, because of sedentary work jobs, as well as students in school who are sitting for prolonged periods of time, or maybe carrying really heavy backpacks on one side of the shoulder. The spine is made up of all these vertebrae, all the way from the neck, the mid-back, and the low back. So this is the back of the spine. These are the bony things that stick out in the back of your spine. And then these are your hip bones. And then this is your sacrum right here, and that's where we sit. I call it the sit bone. So the first thing is called degenerative disc disease. And that's something that's pretty common as we age. And what happens is here, we have these discs in between each vertebrae. So there's a disc between two vertebrae all the way from your neck to your low back. And they are our cushioning structures, and they involve making sure that all the weight that is distributed from the top end of the body is distributed evenly to the bottom end of the body. So what happens with degenerative disc disease is that this lovely squishy disc material that's nice and thick starts to thin out. So as this starts to thin out, I mean, we're holding this weight of our body and gravity's coming against us. So as we get older and older and more gravity is pushing down on us, it's just normal for this disc material to thin out. So that's pretty common, and a lot of people have it and don't even realize it. Any person that randomly gets an x-ray that might not necessarily be complaining of back pain will most likely be showing some kind of degenerative disc disease. The other thing is stenosis or arthritis of the spine. So stenosis, what does that involve? That involves the narrowing of the canal where the spinal cord goes through. So here are all the nerves that are coming out from the spinal cord, and your spinal cord is centrally located through all these vertebrae bones here. And what happens is that that canal pretty much begins to constrict and become smaller, so there's not a lot of space around that spinal cord there. So as that constricts and becomes smaller, what may happen then is that that spinal cord and whatever nerves that kind of come out the side of the spinal cord here will get pinching onto that nerve or to the spinal cord. And for every level from the spinal cord where these nerves come out, they supply different things to your legs. So anything in the lumbar spine here, all these nerves supply sensation. So your pain, numbness, tingling, and then there's the other component, which is your strength. So whenever these nerves become pinched and there's not a lot of room for them to breathe, so to say, that signal that goes to whatever part of your leg that it supplies will become affected. So a lot of people with stenosis usually will complain commonly of both sides, meaning both legs, will feel tired, kind of achy and fatigued, and pain on both sides because it's the constriction of the spinal cord, so it will affect the nerves coming out through both sides. And they will have sometimes some general low back pain, but as it gets worse, more and more of this pain that may start out in the back will then radiate down both your legs. You might just start to feel that it's harder to walk and harder to stand, because as we stand, like I said, that gravity's coming down, and so it starts pinching those nerves. So rest, stenosis patients are feeling okay in a flex bent position sitting, feeling okay. Once you guys get up, that's when the problems start. The other thing that I like to talk about is disc bulges and herniations. Now, the same thing with degenerative disc disease. Lots of people over time will get some kind of disc bulge, but whether or not it's really actually causing a problem may not be the case. But if you are feeling pain on one side of the back and or pain into your one leg, that may indicate some kind of disc bulge or a herniation. So what's the difference between a disc bulge and a herniation? So if we look at this guy here, this is actually showing a herniation. A disc bulge means that some of this material, mostly the outer portion of the disc material, is pushing out onto one of the nerves depending on what level is involved. This herniation means that a lot of the material is coming out, a lot of the jelly from that donut is coming out and hitting that nerve there, and can cause severe pain going down one leg, numbness and tingling, and even if it gets compressed a lot, the nerve gets compressed a lot, weakness in that leg. Degenerative disc disease and stenosis, you kind of feel it both sides, whereas a herniated disc or a bulge, you're more than likely going to only feel it on one side. And that's because the material comes out towards the side and not centrally. If you have multiple levels involved and one happens to be going to the other side, then you would feel it on both sides. But more than likely, when most people just get one, it's going to be on one side. It's really important to take care of this right away. As the time goes by and more of that material just keeps coming out and out on that nerve, more and more issues that become more permanent can occur. So something like a herniation or disc bulge is very treatable if it's taken care of right away. We can reduce the symptoms in the leg, reduce issues with numbness and tingling. However, if that compression has been more chronic over several months, it may or may not ever get better again. And that's when things like surgery come into play. The other thing I wanted to talk about is posture. So what happens is we have these normal curves in our spine. The curve of the neck kind of goes in like that. Then we get to the mid-back and it comes out, and then it goes in. Now, a lot of people will see, especially with women who have like osteoporosis or are getting older, they kind of have that hunched over look in their spine, and that's because this is becoming more evident of a curve. That becomes more of a postural problem. You know, the shoulders come forward, issues with breathing could occur, back pain because the curve is just getting worse and worse. But even just regular postural issues, as far as you may not have a good work setup, a good chair that you're sitting in that's giving you good support, you're doing a lot of slouching, especially if you're sitting over an extended period of time, you're getting tired. So your spine's getting forward and forward and forward, and at the same time, you're actually start losing that curvature in the low back, which is there for a reason, to sustain all that weight through the spine, and that spine starts to flatten out, which then puts different pressures on the discs that they're not usually meant to have. Kids, though, these days are coming in with more back pain because of sitting a lot in school. In school, obviously, desk chairs are not the best. They get tired, fatigued, they're slouching over, writing their notes. Also, carrying backpacks is a huge deal. You know, everybody will carry them on one side, and that's unevenly distributing excess weight through that side. So your back is being pulled to one side because of the weight, your back's getting tired, you're hunching forward again. All those things are causing lots more younger people to actually come in for physical therapy. And then the other thing is, a very common thing is just a sprain or a strain that someone might have because they were improperly lifting something. Like if you're out in the garden and you're lifting mulch bags, and you're not really being cognizant of how you're doing that, you're probably not using good lifting techniques. And so you're putting a lot of stress through that low back area because you're really relying on that to do a lot of the work. And a lot of people end up with back pain because they're just overusing those muscles. The whole point of this is that you do not wait to that point to get it taken care of. So physical therapy, how can we help you with these problems? We can assess the pain and let you know exactly where it's stemming from, and if your pain that you're having is associated with a significant back issue, we can assess all that. We can give you exercises so that your back muscles aren't doing all the work. They have a helper system with your core muscles, because it's really important that your core is strong and that you're not relying all on your back for different activities. Also, some hands-on techniques are super important to be doing. We want to work on the soft tissue components, the tissues that are tight on one side that are, versus the other side that are loose. We can also do spinal mobility hands-on techniques so that we can increase your range of motion in your spine, which may help alleviate some of that pain. We can give you good education about a proper work setup. Lifting techniques, like I said, are super important. There are specific ways we can teach you how to lift something so that you do not get injured. And if you've already been injured by a lifting issue, we can explain to you the proper way to do it from there on out so that you do not re-injure or progressively make things worse. And finally, home exercise program, because our goal with physical therapy is to get you back doing what you love to do. So we want to see you, we want to help you. We love it when people come in, but we also want you to be able to know how to manage it and take care of it on your own, so that for some reason, if you start getting symptoms, you have the tools to try to address it. And as always, if you need more help, you can come back. But we like to be able to give you the tools to maintain that progress that you have made with physical therapy, so we know that you can be aware and take care of things on your own. And those are very important because we want to prevent re-injury. So if you're having some issues with your back or have any questions and you're looking for some help with that, we can see you here at Loudon Sports Therapy Center. All you have to do is click on the link below and schedule an evaluation.